Hi, this is Dr. Antolak from the Gentle Dentist. I'm going to take this mask off so I can speak. We here at the office take your safety very seriously, and we want to make sure that through this COVID season that everybody's protected and you can have a sense of feeling at ease for you and your family. I want to go through just a few of the steps that we've been taking since we've opened up in June. June 1st we opened up, and what I'd like to do is introduce, this is Dr. Thomas.
Hi, nice to meet you.
And Dr. Thomas is displaying what you'll either be seeing us in wearing these masks and a shield like this, or we'll be wearing this called a PAPR, which helps to disassociate us from the environment around. There's actually a filter in the back of it. So let me take you on a little tour of our office and show you what we're doing. First of all, you'll notice that facial masks are required, so when you come to the office, you will have to wear a mask. We're also asking that our patients who have appointments, that they call first, and then we will meet them out here in the reception room. So come on in here. This is actually our hallway that we will be, we'll ask you to take a seat there. We'll take your temperature, ask you a few questions about your health and making sure everything is safe and you haven't been exposed to anybody with this. We do ask that if you have had any exposure that we quarantine for 14 days and then we will take over from there. So come on in. So what you'll do is you'll come through the office, and then we will, once again, we will ask you to sit down there. We have distances between, we try to have social distancing between all of our patients as they wait. Our objective is to have people come in the office as soon as they can, wearing their masks, to get through and get them started with their treatment, minimal time in the reception room. So come on in. Some things that we've done before is we've put these little splash shields up, and then we're going to take your temperature and ask you to sanitize your hands. So as you come in, you'll be greeted by some happy faces, and Lisa, say hi. And then you'll come in, and what we'll do is just a few things that we've changed. So we have sanitizers throughout the office. And as you do come in, you're going to notice a few different things too. Is that we do change our coats, our gowns after every patient. Anytime any aerosols are produced, we do change them. That way we do a significant number of loads of laundry throughout the day, but that's for your safety. And then as you can come in, I'm going to display a few things. And this is Margie. Say hi, Margie.
And he only knows that because my name's there.
Yes, that's right. We do have, in our ceilings, we have special lights that actually take air from the ambient air from each of the treatment rooms, pushes them through here. Above that light, there's a chamber that's a UVC chamber that actually helps to sterilize the air as best it can. Between, we have a fogger, and we'll show you that to you in a moment. And then we also have this is an extra oral filter. What happens is we put this in front of our patient's mouth, and then as they have their teeth cleaned or whatever, any treatment done, it evacuates the air from here, brings it down, filters it, disinfects it through here, and blows the air through. So we're covered through the ceiling and using this, and then we also use this thing called a fogger, and Dr. Thomas is demonstrating it. And basically it throws an aerosol of disinfectant every time after we see each patient. We go ahead and do that, so it actually gets taken care of that way. And the air that's in the air, things settle down and it disinfects the room quite effectively. So come on in. And so after each patient, yes. So what we do is we come on in here, and as we come through, we disinfect each one of our, after every, we can actually reuse these masks, but we use what's called a UVC disinfectant. So in this closet right here, we've been using this for a while, but in here there's lights that help to not only keep the instruments clean, but we actually disinfect our masks once a day for an hour, and that disinfects them so that they're clean and healthy, so we can make sure that we have enough masks that we use on a regular basis. We also have 2 layers of masks that we use. First of all, we use this mask layer here, which is a KN95 or N95, and then we wear a surgical mask over that to help each time with each patient that we see, that we make sure that they can, that anything on our outside that we have with one patient doesn't get redistributed to another person. So, and then of course, because we, in the dental industry, I'll take this off, because in the dental industry we have been doing what's called universal precautions for years and years, we assume everybody is infected, okay? And then if we do assume everyone is and we treat them the same way, that we know that we can blanket everything in a healthy way. So now the difference is, in the past it's always been bloodborne, it still is through the blood. Also, in addition to that, of course, is our aerosols that we have to be concerned about. So we're trying to take all the proper measures to do aerosolization and you'll notice a big difference in that. And if you have any questions at all, you can feel free to ask us and we'd be more happy to answer them. We do sterilize all our instruments. These are our autoclaves. These get sterilized. After sterilized, they go in that unit to stay sterilized. And so if you have any questions, please call us at 586-247-3500. And our website, of course, is The Gentle Dentist.
We're looking forward to treating you all.
Okay, thank you and have a blessed day.